Welcome to another episode of the Dental Insiders with your hosts, Matthew Petchel and Michael Dunn. The Dental Insiders is a podcast for dentists, dental team members, and industry professionals. We'll share stories and lessons from clinicians and industry visionaries with the goal of providing an entertaining and informative look at the industry we share. And today, our guest is none other than Dr. Tony Stefanou. Welcome, Tony. Where we left off. And part one, we were talking a little bit about the disconnect that sometimes exists in dental manufacturers between sales and marketing. And so I'm curious, Tony, besides listening or viewing the Dental Insiders, what would be your top piece of advice you would give a salesperson or a marketeer that's new to the dental industry?
Yeah, so when we really see two types of people out there. We see those that are again coming into dental for the first time, and then others that have kind of bounced around from company to company, and some of it was good. It was just a natural progression, and but I do find for both of them, what's important to recognize is, especially for the newbie coming in, they come sometimes from pharmaceutical sales, or they come from medical device. Maybe they've worked in other sales areas and from a small business perspective, and they come in thinking, oh, this is dental, this will be easy. And I hear that all the time. Even those that come to my how to sell a dentist workshops, sometimes they're asked to go by their company. Sometimes they just decide to come on their own, but they think, oh, it's just dental, it's not a big deal. And I always say, it's not that it's a matter of easier or harder, it's just different. And I think that's the first thing that they have to realize. Know your product, obviously, in your company and your competition, but more importantly, you have to understand the mindset of the dentist. So I think when you first come into the industry, it's important for you to get that additional training, to understand the industry better. That's the first thing. Even if you've bounced around a little bit, I think with the increased competition from all different areas now, people get very set in their ways. We all know that sales is about asking questions, developing trust, and solving problems. But what happens over the years is you get very set. And what's happening now with all the different bombardments that the dentists get from so many different types of companies, what I also find doesn't happen enough is that you have to mix it up a little bit. You have to realize that your questions that are blatant setups, the dental office is tired of hearing it. They're tired of you trying to get past the gatekeeper, so to speak, and get to the dentist. People try all these tricks. They ask the same questions. The one thing I would tell them to do is to focus on the fact that what a dentist doesn't want to hear is that you're coming to them saying, we're the best and we want you to replace what you're currently using, which is the approach that they don't realize subconsciously that they're using. So my advice to them would be realize that there's a place for you in a dental office. It's not necessarily to replace, but get your foot in the door. Become sincerely interested in the practice. You know your product. When it's time for you to get into your product pitch, you'll have the opportunity to do that. And yet what people try to do is rush it and try to impress the dentist so much that what ends up happening is it kind of backfires on them. So my advice would be to get out there and get that additional training. It's not just about, and the other part is, I think, is simple, which I think, unfortunately, I think it's logical, but yet you don't see it a lot, and that is to network a lot. It's all about, we always say that dentistry is a large, small industry, but the truth is there are a lot of companies and a lot of reps and marketers that kind of stay to themselves. And it makes sense for you to become a resource for the dental practice. Know as much as you can about non-competitive products. If a dental office happens to be, you're selling them burrs, but they're all of a sudden, you can hear them say something that they're interested in a laser. Well, if you know someone who sells lasers, you can say, hey, I have a friend of mine that does this. He'll take care of you. Here's their information. And the dentist appreciates that. But I find that you don't see as much networking sometimes from the newbies. And I think that's a mistake. I think that's something that they really should work on, becoming that resource, learning about as much as they can about the industry as a whole, not just your sector. And that would be my bit of advice there.
Yeah, and I think a lot of people come into the industry, people who maybe come from the outside, maybe they come from a consumer world or they come from a different world. And the B2B industry is very much a relationship industry. Yeah. And, one of the things I did when I came in the industry 15 years ago is from an agency side was I got to know all the media. Mm-hmm. And I thought it was just a way to, first of all, it's a very friendly relationship, right? Because, I can help them, they can help me. And they know a lot more than I think people sometimes give them credit for. They're in touch with everybody. They're on every side. They touch every corner of the industry. And I think having a great relationship with those people helped network me to the point where,
I think especially, we're talking about both salespeople and marketers. I think especially on the marketing side, sometimes
Right.
I think you make a great point. It's people discount the value that the media partners can bring and the knowledge they bring.
Yeah. I mean, the good ones know as much as anybody. They really do. And the ones that people come in and leave is here for a year or two, but the ones that have been around for 5, 10, 15 years, they know a lot.
Yes,
They know
do.
a lot. They're a valuable resource.
Well, dentistry in particular, I totally agree with you guys. And dentistry is about it is about that networking. It's somewhat, I always call it an incestuous kind of industry, in that everybody does interact. And if you're at a trade show, for instance, instead of just going to your company dinner that night, you should be going to different receptions. You should be networking. Have someone that you already know in the industry introduce you to the publishing, the companies, all the online, the marketing people, all of that kind of stuff. Because this is about referral. It's about relationship. And if you're in sales and marketing, you have to do more than just pick up the phone and cold call or just walk into offices. You can't really get market share by doing that anymore. You have to develop relationships with all sectors within the industry.
Yep. So clearly you're an entrepreneur. It just sort of oozes out of you that you just love businesses. You're interested in people. You like fixing things. When did you realize that you were, that being a normal person with a normal job wasn't in the cards for you?
Yeah, well, I don't know. People would say that when my dental school classmates would say that they always kind of saw in me that I was always thinking about things from always looked at things from a different angle. Maybe that's true. I don't know. I think it probably started back in college. I was, I was kind of one of those fraternity guys that we were a fraternity that, unlike most fraternities, were just kind of scrounging around for the next dollar to find, to buy a bottle of Pabst or something like that. We actually looked at things. Our fraternity always did things where we threw big events, we threw bigger parties, we got involved with things outside of campus, nonprofits and charitable things. We threw parties where we made thousands of dollars, and and I was part of that thinking even back in college that there's always other ways to do things. And I guess that's where it started. I knew early on I wanted to go be a dentist, but as I said, the wheels some people, I think, you're just always thinking, and that's what it came down to from my end. And, I'm very happy about the way things progressed. And, it's not easy to make a decision to get out of clinical. In this industry, everybody's always about, you have to stay wet-fingered, you have to do all that. I know my limitations. Let me put it this way. You won't see me up on the lecture stage at Chicago Midwinter talking about posterior composites and bonding agents and stuff. I know about the products and I know what they do but I look at them from the sales and marketing perspective, not from the clinical side. I'm not credible if I go up and I talk about here's how you place this or here's how you cement this at this point. And I know that. So you have to know, as an entrepreneur within any industry, you have to know your limitations, you have to know your strengths. And I can use the fact that I am still a licensed dentist. I had 20 years of clinical, but I focus on what I know right now. And I think that's the key to being an entrepreneur.
Yeah, I'm going to switch gears here a little bit.
You're a gear shifter.
Yep. And in part one of our interview, you mentioned one of your entities, Connect the Dents.
Right.
And so, in the last few years, especially, I think the dental industry has gotten quite a bit of attention from investment entities, private equity, venture capital, what have you. And through Connect the Dents, you do quite a bit of M&A work. So, from your perspective, why is dentistry, and maybe especially now, why is dentistry so attractive for these quote unquote outside investors?
Yeah, things have changed fast. A few years ago, we would talk to people that were involved in investment and the PE people. They looked at dentistry as just being kind of small potatoes. There was nothing that had really excited them there. Things have changed for a few reasons. I mean, obviously economically, just as a whole, everything has changed in the business marketplace. But I think what's happened is PE people in particular are always researching new things. So I think what they did was they had a lot of success in healthcare. Dentistry was kind of like the poor stepbrother in that. But they started to, I think, recognize that there were a few things happening. One was that from a manufacturer side, there are lots of generations and generations of kind of what you would call mom and pop operations that have been passed down. They started to see a lot of companies that were in that 3 to 5 to 10 million range realize that some of them don't have an exit strategy. Also realize that some of them aren't going to be able to keep up with some of the bigger dogs out there and not grow organically. And so what became a natural progression there was that, hey, we're a PE company. We've been successful in other areas. Why don't we get involved where we can help a small to mid-sized manufacturer, invest some money into them, and then instead of worrying about organic growth, just go in there and buy some other mom and pops that have been around that have good products but don't really have a way to get to that next stage. And when they looked at that and said, hey, we could put in $10-20 million, we can buy 3 to 4 other companies. In a few years, we can now sell the larger entity. That's what they do. And they realized that dentistry was a perfect fit for that. There has to be consolidation. Let's look at it. There are hundreds of implant manufacturers. There are, 120 different types of composites, from a restorative and implant, prevention, every aspect of dentistry. There's so many different, and not all of them can get to that next level. So PE started researching. They've been keeping an eye for the last couple of years. They realized it's time to get in on that side. And then the DSO side of it. And the DSO side of it is, when a dental practice sells, there are different formulas out there, but to keep it simple, very often, we talk about EBITDA, we talk about a percentage of revenues. Dental offices usually sell a little bit less than 100% of 1 year revenue, and that usually comes out to about 2 to 3 times EBITDA. So if a dentist sells to another dentist, they're selling, let's say they do 800,000, maybe they sell at 550. That's great, and that's the way it always was. But there's a problem now. The problem now is that dentists are coming out with a lot more debt. They're waiting a little longer to buy, and even if you find a compatible buyer, you want to sell to another individual dentist, the dentist isn't always able to get financing, or at least 100% financing like they used to get. So it's become a little trickier. The PE companies have been looking at this, and they've been watching the fact that there's a reason why dentists also like to do dentistry. They don't always like to do the clinical side of it. They don't like to do the administrative side of it. They've been watching all the emergence of the DSOs and the groups, and they started to realize, hey, wait a second. We can get in now. There are dentists right now that it's their best bet is to sell to a group. Why don't we form DSOs? Get it to 10, 15, 20, 25 practices, and there's always going to be a larger DSO that buys them. They can provide administrative services and management services. It can be a win-win in many cases, even though, there is this stigma out there that DSOs aren't good. There is a place for them here. And what's important is the PEs are looking at the bottom line. And so just like with manufacturers, they understand now that if they get to 10, 20, 25 practices, they're not going to sell. They're going to sell at 12 to 14 times EBITDA. I mean, that's something that's going to catch a PE. They're going to catch their eye. And so how much longer that can hold up, that's a different story. We could talk about where this is going. But for now and for the next 3, 5, 7 years, it makes sense for the PEs to play on the manufacturer side and on developing emerging DSOs, because they understand the profitability factor. And to them, that's what they're looking at. And so, this is what's happened. And it's all happened really within the last 2, 3, 4 years. And it makes sense when you really start to think about it.
So where's it going then? So in 3, 5, 7 years, the numbers aren't going to quite be there anymore, and half of the industry will be DSOs in 5 years?
Well, look, there are the mathematicians out there, and they always look at trends and they start to project. And, there's this kind of doomsayers thing out there about if you're an individual practitioner, you want to stay as a solo, you want to stay as a private practitioner. When I got out of dental school in 1987, 85-90% of practices was solo, private general practices. The number now has gone down significantly. We're in depending on who you look at numbers wise, we're in the 60s. They're saying in 4 or 5 years, it's going to be about a third of the practices, only a third of the practices will be left that will be solo practitioners. Right now, 20% of the dentistry in this country is done through a DSO group. We know about 7% of the practices are DSOs. The reality is if you start projecting out, they're growing at 20-25% compounded. The truth is that things are going to slow down a little bit. They have to. And the reason for that is just simply that the DSOs are going to get to a point in a few years where rather than focusing on acquiring or affiliating with individual practices, some of them are going to be ready to sell to the larger DSOs. So some of the larger DSOs are just going to get larger. There'll be a slowdown a little bit in individual acquisitions. And let's face it, there are still going to be a good number of dentists that go into dentistry because they want to practice on their own terms. There are patients out there and consumers that even though they will visit convenience-wise and the fact that a DSO-affiliated office provides a lot of services, a lot of them still want to go to their own dentist, and it's going to slow down the process a little bit here. I always talk about, people say you're going to be able to coexist. So the individual practices and a DSO is going to be able to coexist. And I don't say they're not just going to coexist. They're both going to be able to thrive still. I mean, it's a little bit different economically for a private or a solo practitioner. But the truth is that there's a place for both of them. And it is going to slow down a little bit here. So a few years from now, I'm not sure where the numbers are going to turn out, but we'll be okay.
Be all right. Would you, really quick question, would you, if you were practicing today, do you see yourself becoming a DSO, being acquired by a DSO, or would you resist it?
Well, I mean, I would say that I would consider it only because I've studied the model. And well, there's one thing I think a lot of dentists don't see. I've done a lot of surveys about this, and it's changed in the last 12 months or so, where dentists still have a negative impression overall. But you got to remember, dentists also look at DSOs as all being the same. They're all looking at it like, oh, they're like Aspen or Heartland, and those are successful DSOs in their own right, but they have completely different models. And so, you can't lump them all together. That's the first thing. I think dentists are starting to recognize that there are DSOs that have they're not just quantity of patients. It's not just about lower income people or anything like that. It's about, a lot of DSOs are now investing in the latest technology. They're offering a lot of services. They offer some good things. The answer to the question is I would be open to it only because I've now seen some of my closest friends who practice at a very high level that have been approached by DSOs, and some of them now, even though they're not in retirement stage, a lot of them are in their 40s or early 50s. Some of them in their 30s even have decided, hey, you know what? This is not a bad deal. I'm going to get a good price for my practice. I can stay on. Some of them have great incentives to grow with the DSO, whether it be stock and other things. There are some models that are very attractive where a practitioner right now that wants to focus on practicing or might look at it that, my practice has some pretty good value right now, and from a business perspective, it makes sense. So the answer would be, a few years ago, I would have said probably not. Now, I would say that I would certainly, I would be open to it, is the best way I can say it.
So you mentioned earlier, you talked a little bit about dentists coming out of school with a debt load and how things have changed. So in today's landscape, what's your number one piece of advice you would give to a new grad coming out of dental school? Well,
my number one bit of advice would be, to be true to yourself. I know it sounds kind of corny to say that, but, I always say dentists become dentists for two reasons. One is that they want the lifestyle of a dentist. Most dentists could get into, they could have gotten into medical school or wherever they wanted to go. They're smart people. Just like, I work with chiropractors. Chiropractors go into chiropractic for a reason. They're generally laid back. They're very natural, healing oriented. That's their style. Dentists go into dentistry because they want to be doctors. They want to have their own lifestyle, set their own terms, practice the way they want to practice. They're a little bit artistic. They're a little bit part engineer, part mechanical oriented. And those things together make them want to become a dentist. And if their vision was they wanted their, free operatory office, and they wanted to take care of patients, or they wanted to provide certain procedures and to do it according, to the hours they wanted to practice and to do the way they wanted to do, then be true to yourself. Don't rush into having to buy a practice. Don't settle. A lot of them settle for practices that aren't compatible with the way they want to operate, because it's like the same thing when you buy a home. Like, oh, I have to buy a home, and sometimes you settle. You should never settle. I always tell them, if they come out with a large amount of debt, you know what? Consider working for a DSO for a couple of years. That's a good place to learn, get experience. You could always stay within that model, or you can open up down the road. It will help you at least pay your bills at the beginning and get you some experience. Don't jump at just anything because you feel, I'm a dentist, I have to have my own place. And the other part is, the other bit of advice is to get more training on the business side of things. We all know that curriculums in dental school, I had a maximum of 2 days out of my 4 years were devoted to business and management. I would urge them to take additional outside courses. There's a lot of CE programs now on learning how to become better at managing. Dentists are operating at 70% overhead, general dentists. We can argue all day whether or not what that number should be, but the truth is, the new dentist, especially with a large debt to start off, and the fact that they're going to have to invest in technology, they're going to have to finance, is just going to add to that. And so they have to keep abreast of how to keep overhead down, how to invest in technology properly, and how to stay true within the vision of why they wanted to be a dentist and not sell out. That's the best way I can say it.
Nice.
Yeah. So what's the future of the industry? Where are we going? What can we all do? You're an industry guy. Was your dad a dentist?
No, my dad was a stockbroker. He was a restaurant owner, did a little bit of everything.
So, but he was an entrepreneur, right?
Yeah,
so
pretty much, yes.
He's a business guy and an entrepreneur. So, and you got into dentistry. Why'd you get into dentistry? I don't know if we covered that at the beginning.
Well, I was kind of fascinated. I was interested in science, and that was my big thing. I did not want to be a physician. I didn't want the lifestyle, didn't want to deal with hospitals, the pharmaceutical industry, and everything else. To me, I was the same thing. I wanted a certain lifestyle, but I wanted to be a doctor. I was fascinated. In high school, I volunteered and worked in a couple of dental clinics, and it was a natural fit for me at that time. Yeah.
Yeah. So then we're all industry guys. We've been in
Right.
it. We haven't been in it as long as you, but we're in it. We talk about it all the time. We're probably stuck here forever.
Yeah,
so
we
what do
always
we
say
do?
no dental
What can we all do? What wisdom can you share to that we can make it a better industry? What can we all do? We're doing this podcast. I don't know that it makes a dang bit of difference, but we do this podcast. We're not making any money at it.
How can we leave it? How can we leave this industry we love better than the way we found it?
Yeah, that's the question.
That's the question.
Well, I think the best answer is to realize that we have to make sure that we don't get stuck in our ways. We complain sometimes. We're sitting around at the conferences, we have a beer, and we talk about things. There are things that are naturally have to change. Technology has changed everything, and business has changed everything. So I think the industry itself, the organizations, and out there, first of all, the trade show, the whole trade show thing has to be revamped. It doesn't work the way it does now. Too many companies are spending too much money. They feel trapped. They have to be at shows. They shouldn't be at shows. We have to change that. We could talk about that all day, but we have to look at other models, like what happens in Europe and Asia, and the way they do things that are probably more effective to educate and showcase products, and to make it easier for dentists to be able to learn about what's new and great out there. I think the companies. What else do we do? We have to follow the demographics. We have to realize that there are a lot more female dentists coming into the industry. There's a lot of internationally born dentists that are now practicing here. They have different ways of doing things. They have different ways of buying. They have different ways of looking at how to run a business. We have to be open to what's going on with things like the DSOs, and to just embrace the fact that there's something here for everyone. And I think we have to be a little more open-minded. I think the industry is also changing, where we can't be so resistant to recognizing that there are some things that again have been around and probably going away. This is controversial when I say this, but some of the specialties, we're not going to see some of the specialties thriving, and then they may be at some point, when it comes to perio and endo and prosto even. You look around the world and you see that we may not need to have all the specialties the way we have them now. GPs are going to be doing, and they're already starting to do a lot more. I think we have to create a better environment for the companies that are selling products, and the way dentists think. Dentists are always unavailable. They get hit with so many solicitations. We have to make it better. We need each other. The dentists need to work with the manufacturers and the supply companies better to learn, and we can't be so resistant, and we have to embrace each other in a way where we do things better. We have to be more prepared when we speak from the manufacturer side, more prepared when we speak with the dentist, know more about the practice ahead of time. If you request something for the dentist, like for instance, you have a 10-minute meeting with a dentist, if you need a computer, if you need to be in an operatory or to be with them in the private office and talk to them, request that ahead of time. Honor each other's time commitments. There's a lot of things right now. We see a lot of things out there that aren't, people don't stay on schedule. They're always running late. And so that doesn't help either side either. So how can we help the industry? The other part of it is there are so many products that also are out there that have to sell direct. They can't go through dealers for a number of reasons. We have to work on ways to helping those companies get more exposure to the dental offices. Dental offices now buy from more than one dealer. 91% of them use more than one supply company now. 93% of dental practices order from 5 or more direct companies regularly. These things have never been that way. They've changed. And so we have to be able to embrace the fact that we've got to have a better way of communicating, marketing, selling, having dentists keep up with things where they're not afraid to speak with people. These are things that we have to all work on. And that's really one of my, obviously what my mission is. And the other part of it is recognize too that, consolidation's okay. We do have too many companies almost in too many sectors, and there's going to be some gobbling up out there, and that's not always bad. In our industry, I think it's good because I think there are too many choices. And I think we have to recognize that for the next couple of years, we're going to go through that transition. It comes down to what I said earlier. We have to be open-minded about what's happening. Study the demographics, follow the trends, respect what the dental office is trying to do, and their way of thinking and practicing has to be respected by the people who are selling to them. And I think that's the one thing I think is missing very often.
So we're running up against the end of our time here. We appreciate it. One final question, very quickly. What's your favorite book on business?
My favorite book?
Yeah.
On business.
It's not even. I don't even know if it's considered a business book. It's a pretty simple book, but what had a big impact on me was Purple Cow by Seth Godin. That was a book. I was just talking about being remarkable. A lot of people forget that. I always talk in my courses. I always ask the question, and it's kind of a trick question. So I agree. I'm trapping people sometimes, but we do it in fun. And I always say to them, why should a dental office buy from you? And they always talk about their company. Well, because our company does this or our product does this. I said, no, why should they buy from you? And to me, look, it doesn't matter what industry you're in. We're all in sales. We're consumers. Running a family, everything we do is about selling each other or buying something that's out there. And I always talk about the fact that what makes you unique, what makes you special, valuable, or remarkable. And the Purple Cow book always talks about remarkable. If you're running a practice, what makes your practice remarkable? If you're selling a product, what makes you remarkable that dentists would want to buy from you? So that's my favorite book. It always had the greatest impact on me. I always said 2 people from one company can go in and speak to someone. One person gets the account, the other one doesn't. The reason for that is they're selling the same product. One person is remarkable in some way, and whether that's increasing the chances of them being trustworthy or just how they develop relationships and rapport, but they're remarkable in their own way, and that's why people buy from them. And I think that's really what I always keep in my mind when I'm working with companies or I'm working with practices.
I think that's a great way to wrap it up with with the remarkable Dr. Tony Stefanou. Thank you for joining us, Tony. We appreciate it.
Yes.
Thanks, guys. It's been a lot of fun.
We'll definitely, I think there's a long list of other topics we can talk about on future podcasts.
Let's do a part 3.
Look out for that.
Whenever you're ready.
Yeah, thanks for spending your time with us on the Dental Insiders. Please join us next time and tell your friends about the Dental Insiders podcast. Thanks, Tony.
Have a great day.